of minutes. With that said, we have such a great lineup in store for you today. But first, our community, which as always keeps growing. We'd like to introduce the following organizations who have recently joined us. It's great to see organizations from so many different thematic areas and also regions. So here's our newest community members. Mercy Corps Niger. So Mercy Corps Niger has been present in Niger since 2005. Their Tsari project aims to improve the livelihoods of young migrant men and their families through a package of services, including information provision, financial inclusion in education, soft skills training, life planning, migration, and transport subsidies. And the WhatsApp chat service is another method for users to register for that program, so super cool. We also have Yali Regional Leadership Center. They are part of the United States government initiative. Yali offers an innovative and game-changing leadership training program in Africa. The program is hosted by Ghana Institute of Management and Public Administration, and their WhatsApp chat service will allow students to get course content and latest updates. Next up, we have Access Afya, which is a Kenya-based health tech organization, and they're building a WhatsApp chat service to educate and engage users on maternal health, child health, mental health, and sexual reproductive rights. They have already recruited and screened 4,000 people into care at their clinics and will use WhatsApp as a readily available communication medium. Benacare, up next. Benacare is a social enterprise based in Kenya. They're building a WhatsApp chatbot that will offer educational resources, tips for lifestyle modifications, reminders for medication intake and appointments, and will also be a platform for diabetic and hypertensive patients to receive guidance and prevent them from developing kidney disease. Our following case would be Kina Care Indonesia. Welcome, Kina. Kina is an AI co-pilot for Indonesian parents and caregivers, and they aim to address the barrier of finding reliable parenting information by providing personalized chat-based support. Next up, we have Sena Health Academy, a UK-based organization doing work in South Africa. They design and deliver training programs tailored for healthcare professionals aimed at enhancing their knowledge and understanding of digital health tools and platforms. And their WhatsApp chat service is a solution for providing micro-learning as an effective learning approach to deliver short, focused bursts of information to learners. Last but not least, we have the Think Positive, Live Positive Support Initiative, which is a youth-led initiative that promotes the sexual and reproductive health rights, mental health, and welfare for sexual and gender minorities living with HIV in Nigeria. Next slide, please. And more on exciting news. We have the upcoming launch of the Argentinian Electoral Authority chatbot. They recently joined us to launch 2 chatbots for the upcoming presidential elections in October. The first chatbot is a citizen-facing chatbot, which will provide several different electoral services. Citizens will be able to check their voting location. They will provide general electoral information. You will be able to justify, if you're an Argentinian, justify if you are not able to vote. And you will also be able to submit complaints in electoral departments. And through this chatbot, over 35 million citizens will be able to check their voting location, which is incredible. And later on, closer to the election, they will launch a second chatbot dedicated for an internal audience, which are the delegates that work during the election, and that will help delegates perform their duties during the election day. So very, very exciting, loads of new use cases and community members, and we're thrilled to have you all here. Next up.
Thanks, Shal. Hi, everyone. I'm Pippa Yates, and I'm one of the co-founders here at Turn. For those of you who are new here, I'm pretty energized this week because I was lucky enough to do a quick trip to Nairobi last week and got to spend some really amazing time with the team at Penda Health. I see some of you on the call today. Thanks so much for hosting me and showing me around Nairobi and the amazing work you do at your clinics. And I also got to some government clinics, as well as spend some time with the team at Farm Access. So feeling very energized, But the other exciting thing that has been happening this month for us as Turn is we've had all of your amazing applications to the Chat for Impact Accelerator Health. And so I just want to say a very big thank you to everyone for applying. The quality of applications is incredible this year. I must say it's the highest quality we've ever had. It's going to be so tough to choose those 10 finalists, but the judges are working hard over the next 2 weeks to interview the most promising applications, and then finally to get down to those 10 organizations who are going to be joining the accelerator and getting a $25,000 to kind of accelerate their program. So very exciting, and thanks so much to everyone for all your effort in your applications. We do really appreciate it, and good luck to you all. I'm going to hand over to Neelke, who's going to share some product updates.
Great, thanks, Papa. Hi, everyone. I see a whole bunch of new faces today. Makes me very excited. And for that reason, I'll also introduce myself. My name is Neelke, and I'm based in Cape Town in South Africa. I'm going to share 3 exciting product updates with you, what we've just launched on the canvas, things I think is going to add a lot to your world. And then Simon will also share a little bit of the upcoming roadmap. So what is new on the canvas? There's 3 new blocks that we've added. The first one I want to highlight is the ability to start a stack from another stack. Best way to think about it is you can now connect all your pieces. So let's look at an example. You have a menu and you give your users 5 options. They can maybe get a teleconsult, or they can set up an appointment booking, or you give them some FAQ, like they can navigate a health journey, or maybe there's a health screening that they can go through. So each of those 5 options is really a functionality that someone come to for on your chat service. And each of those functionalities you manage within a stack. And if you look at the little image on the slide, you will note that there's a menu, there's the options, and each of those options now kick off a separate stack. So that's on the canvas. Yeah, it's been requested by many of you, and it makes the canvas much more powerful. It also helps you to organize your service into multiple stacks that you can easily manage together. So yeah, have a look and please use that and give us feedback as always. The second block that we've added to the canvas on the next slide is called a code block. And so if you started using the stacks right when it was only code, and then we introduced the canvas, and now we're putting those things together. So it really gives you a lot of freedom and flexibility. Think about integrating CRM data at the right point in a chat journey, or sending data to your CRM, or utilizing the power of machine learning models. So it's a short snippet of code, and you put it into your visualized chat journey, and you can really do many things with that. So that is launched today. This is fresh off the press news for you. Use it and let us know once again. And then the third one, and we've been alluding to it, and we're very close to launching it. The third block that you will soon see on the canvas is called Route to an Operator. And so this one, I'm going to give you guys a bit of a more deeper demo, but it's really about facilitating uninterrupted conversation. So there's nothing worse than someone chipping into your conversation, and it's actually much worse if that someone is just an automated service. So we've worked on improving human bot handover. We had multiple of you guys actually giving us insight onto what will be helpful. So I'm going to show a first video, what it will look like for the user on WhatsApp. So if you look at the video, I'm triggering my service, and we're at Easy Clinics, and I'm saying, what can I help you with? And you say, no, man, I want to talk to a doctor. And there's a little bot telling you, well, let me just check your question and get that. And so as the user, I'm saying, help me interpret my blood pressure results, or how do I do that? And then the bot's like, cool, thanks for the question. I'm going to go and fetch you a human, and just wait a little while. And then the next moment, someone's saying, hey, Neelke, it's Rakesh here, and thank you for reaching out, and let me help you with understanding blood pressure readings. And then Rakesh gives me a great explanation of how to do all of that. And I'm very impressed, and I'm like, oh, wow, thanks. That's super helpful. And because Rakesh is great at customer service and helping me, just make sure if I need anything else, or if that was good enough. And then I'm saying, no, man, thanks, I'm all good. And Rakesh, who's been helping me, been a real human, just saying, I'm glad I could have helped you. Where's my video? Yay. Then I'm happy. And then it hands me back to the bot. And so there's little emojis helping the user know who they're talking to. And there's a more clear handover point. And yeah, there's research been shown then when people know they're talking to automated service, they have a certain level of patience. And then when they talk to a human, it's almost like two different mindsets. So that's the user experience on WhatsApp. The next short video I want to show you, so what does that look like on the flip side for the operator? So the person in turn doing the help desk. Let's just, sorry, might skip new slide, not this video again, sorry. Yeah, there we go. So this is the same conversation, but this is in turn. So the person requested to talk to a doctor. The bot was still asking, what question do you want? And then I take over as the operator. And in the bottom, there's an indicator telling the person on the help desk whether the bot is active or whether the bot is paused, right? So there's a clear knowing that automation can't interfere. And so we're having these conversations that you guys have seen on WhatsApp, where Rakesh is actually explaining to me the question that I ask about, and the user saying thank you. And then in the end, when all of that is done, and I'm said, no, I don't need other assistance, I click close and resume bot. And it once again tell me that the bot is active and that the user can continue to interact with any of my menu or whatever else is on my chat service. So that's the user and that's the operator. And then the third part I want to show is just like, and that's not a video, Kanya, we can jump to the next slide, but really how do I set this up in turn? So once again, on the canvas, you will soon see a new block and it's called root operator. And if you click that and you go into the settings, you will, in that right-hand panel, you will note all the messages that you've seen, all those automated messages. So there will be default messages, but you can go and you can customize it for your service, right? So we're giving you short WhatsApp friendly copy, but your service might not be in English, or you might want to change it, you know your users well, and you can go and make sure that that root to operator copy that is the way you prefer it. The question from the user also get tagged with a request help label, and you can easily find those conversations in a collection. So this was a short demo. We will, when we launch it, make sure that the product updates have all of the videos and all of the journey collected, or just described for you. But yes, so that's the three new things: start a stack, route to an operator, and a code block, all of that on the canvas. And yeah, have fun with it and set up those services. Simon, I'm handing over to you.
Thank you. That's all very exciting. I got super excited when I was seeing these demos this morning. My team can attest to that. But that's not only it. What else do we have to look forward to? Now, we've spent the last few weeks, sorry, we can stay on the previous slide. We spent the past few weeks talking to you all about how you're using Turn to have personalized conversations with your users about their health towards better health outcomes. And so asking you, what can we improve and what can we do to better serve your users and your ability to have a greater impact? And so there's a few things that I want to highlight and show, as in these are upcoming features that we are working on in this quarter. So we can go to the next slide, Kanya. And one of the most important improvements that we've heard is that we need better ways to provide, or better tools to allow you to connect your users who have their questions and their needs and their concerns with the operators or help desk staff or professionals that are actually available and able to answer those questions. And so we're addressing this with what we're calling inbox routing. It allows you to route important conversations and queries to your team members who are available and who are able to answer and provide support. And so in the screenshot, you can see, you can specify your business hours. When are you available? And can you set up an automatic response when you are not, for example? But also, are there specific topics that specific team members are better suited to be answering for, or who simply have, the relevant expertise in order to answer those questions? And can we automatically route those conversations to those users? So that's up and coming, and it's called inbox routing, and we're very, very excited about that one. The next one is a completely redesigned help desk. And it's one that's centered around the help desk operator, the person talking to your end users. And it's a personal inbox with their priority conversations with their users. So the existing functionality will continue to exist, but we're centering the functionality more around the needs of your team who are making themselves available to answer your users' questions. And so we're very excited about this work, and we look forward to sharing more about this in the weeks to come. The main difference here is that every operator, everyone answering questions from your end users will have a personalized own inbox with their questions with their users that they can focus on, so that we can get to the questions that need answering this sooner and faster, and just provide a better engagement and experience for your end user. The next slide talks about personalized information at the right time. We're improving how to send the right messages, the right content, the right nudges at the right time with triggers. And triggers are deeply integrated into the canvas, which is what Nilke was talking about earlier. And they allow you to specify which people should receive which messages or interactive prompts at which specific times on their health journeys. So we're making sure that we are able to provide the right information and services at the times that people need them to improve their lives. And so as you can see in the screenshots there, you can set up various triggers, but also conditions for those triggers, and then what should happen when those conditions are met. So say someone changes their blood pressure reading or some other things that relate to their health condition, what should actually kick in? And so we believe that this is a really key improvement for Turn, for you all to be able to have an impact. Then, there's two more things. The first is better handling of sensitive patient information. So with the improvements of the help desk, we really believe it's a fantastic tool for having long-running conversations with your end users, about personal long-running conversations, possibly about their health or their children's health and things like that. This means that at times information shared is simply personal. It does not need to be shared publicly, even in an interface like Turn. And so we're improving on the ways that we identify private information, and then giving you the tools to say, okay, when we see that information, do we show it or do we not show it? So that Turn really is the best possible tool to have long-running personal conversations that are private around individuals' health and their outcomes. The last thing I want to talk about is that well, as you can tell, we're incredibly proud of the progress we're making on the canvas. And we're going to be creating a fantastic set of health use case templates that we are making available to everyone. And so these will showcase the features of the canvas and the ways that we can use to deliver an impactful service, so that like if you're using Turn and you're designing your health journeys, for example, you can study these templates, or you can use them or reuse them and repurpose them for your specific use cases. And so those will become available to everyone over the coming months. We're very excited about that. They will be using all the features that we're talking about today, the human bot handover functionality, the code blocks, the ability to split your content and your service into various stacks and call them from various places. And so look out for those. We're very excited about this as a team. And that's it from me. I'm handing over to Pippa on the community section. Thank you.
Thanks, Simon. So today on the community section, got a new announcement. So we have, I don't know, a lot of you have already realized, but we brought back the Turn Townhall WhatsApp group. So we used to have a WhatsApp group that we used to chat to all of you. And at that stage, WhatsApp groups were only allowed to go up to 256, I think. And we completely outran the WhatsApp group, but yay for WhatsApp. They've extended that group limit and added more community functionality. So we are back on WhatsApp. And we'd love you to join. This Townhall group is really where we get feedback and share as a community on what we're doing. Think of it as an extension of the learning and sharing that is happening here in the Townhall event every month. Please join. We do obviously still have, as Turn, our normal support line. Continue to use that as you do for all of the product queries and feedback on the Turn specific product. The WhatsApp Townhall group is really talk about chat for impact and how we all learn together about how to do this better and better every day. And then thanks to all of you who attended the education roundtable. that we ran a couple of weeks ago. We wanted to have a share out, so there is a in-depth overview of what was discussed, some of the great learnings that we uncovered. A big thanks to the teams at Darsal, New Globe, ED and Rising Academies for being on the panel. And have a look, read that, or watch the discussion if you would like. All available there, and very great insights. Wish you all could have been there. But I'm really excited now because I get the huge privilege of interviewing and doing our community showcase. So I want to share a warm welcome to Tracy. Tracy is here from Guidepost, and she's the head of product there. And Guidepost works with people with diabetes, and I'm going to get Tracy to give you a little bit more in depth about exactly what they do. But I unfortunately have only met Tracy once because she decided to move overseas all the way to England, but as a South African at heart and very passionate about improving the lives of people with diabetes. So welcome, Tracy, and thanks so much for being willing to talk to us today. So if I can hand over to you to tell us a little bit more about Guidepost and what you do.
That would be great. And hi, everyone, and thanks, Pippa. So Guidepost, we were established
Tracy, I
in
think you're on mute. Could you please grab that mic?
I'm not on mute. Can anyone
Yeah,
else
Tracy,
hear
we
me?
can hear you. Yeah, we
Can you hear Pippa?
Sorry,
Okay,
it's
good.
my fault. Sorry about
Yes,
that.
no problem. Okay, so at Guidepost, we were established in 2012, and the reason for Guidepost's existence today is definitely to improve the quality of life of people living with diabetes. Now, diabetes, it's a condition that affects more than 400 million people globally. So we've engaged with tens of thousands of people in a coaching relationship, typically where a nurse or a dietitian who is a diabetes expert would work with that person who has diabetes, and they would be working to inspire data-driven, sustainable change to how that person manages their diabetes. As we've discussed before, Pippa, we know at Guidepost that relationships are the key. They are what is all important to inspiring the meaningful change that is going to make the difference that that person needs to see. And what we're busy doing right now is that we're working to embed that same diabetes coaching expertise into what we're calling auto coach chatbots. They're using similar techniques, and with them, we're helping people with diabetes so that they can actually win.
Amazing, Tracy. I mean, I think exactly. We've had lots of conversations about the role of the human in this relationship, and what do we need to, as we move over from, as you guys were moving over from voice calls and having that human ever present in that coaching to what parts should be done over automated system, and what parts do we still need to keep a human in the loop to keep that patient accountable to their goals and to keep them on track. So tell me a little bit around the exact problem you're solving on WhatsApp with Auto Coach that you think is really useful as opposed to your model that just has calls.
Well, one of the things that we've really noticed, and that is obvious every day that we speak to somebody with diabetes, is that they're in a 24/7 struggle with their diabetes burden every day of their lives. And the thing that most people will tell us is that they want to connect with somebody who will be able to support their journey in little ways, mainly so that they don't feel alone in their diabetes walk. One person described it to us as being able to sense check what they know they probably should be doing with somebody else who can speak that language with them. So in short, the other thing that we could say that they most often lack is simple encouragement, because they need staying power so that they can do the same regular jobs, make the same regular decisions they have to make in order to win with their diabetes. And that's something that a chatbot is really good at. Simple engagements regularly.
Yeah, exactly. So what is the goal here? What are the outcomes you want to achieve with this chatbot? What are you aiming for?
I think the most important, given that what we've just said, is evidence of repeated positive engagement. So we'd like to replicate the engagement outcome we've seen, where we saw 33% of people in smaller groups that we were engaging with who became high engagers with this auto coach. We want to replicate that into larger groups of users over the next few months. And then out of that, what we'd be looking to demonstrate would be clinical outcomes within those engagement groups, where we would see more of their blood glucose readings be in target, and we'd see just evidence of people engaging. We ask for a rating each time that we engage with somebody, and being able to receive ratings that tell us they're getting meaning from what they're doing with us.
Amazing. And so tell me a little bit about the content you send on WhatsApp to these users that you're hoping is going to help them manage their diabetes better. I know if we go to the next slide, we can see some examples. Can you chat us through?
Yes, so this will be great. This is quite exciting. What you're looking at is a couple of clips that I took from our system with somebody that we have been engaging with. And I've obscured the name, but it's a real person. And the format is not exactly what you would see on WhatsApp. The system ignores the line breaks and it runs on, so it looks a lot better when you look at it on WhatsApp. But essentially what you're seeing is content that is actually quite simple, much more simple than you might expect, that would stimulate this behavior change. So the first thing you'll notice, and you'll have to read from the bottom up because the system shows us messages from latest at the top to earliest at the bottom. So we reach out to these people on a weekly basis, typically, and we start out by asking them if they'd like to see their data. These are people who are using a continuous glucose meter, and we receive the data automatically in the system. So this person says, let's get started, and immediately they receive a summary of what their data looks like. And we then ask them to think about their week and how the week went. If it didn't go well, in this person's case, if you skip to the next slide, said that he had some challenges, we would then ask them if they want to chat with the person. And this person said, no, thank you. But many people do take us up on this in this particular program. So immediately after that, we ask them to think about what could have caused the data that they're seeing in their week. And then we would always offer some encouragement. We find that is just that positive engagement is really something that somebody living with diabetes needs. To tell them that they're doing well, just staying the course. Then we would ask this person to set a goal and hold them accountable next time round when we meet with them again via the auto coach. And really what we found, in the words of one of our users, is she said, Libre Coach helped me to step back, to look at my diabetes control in a holistic way and not just go from reading to reading. It allowed me to identify trends that I could manage instead of overreacting to each glucose reading that wasn't perfect. My Libre Coach reminded me to set action plans that I could achieve in 5 to 7 days and to go for small wins, knowing that they would add up to big wins. This was really beneficial because so often you don't really know where to start to improve your control. It worked so smoothly. And this was the key phrase for me. It didn't even seem like I was engaging with the chatbot.
You've obviously done a great job with your content to get feedback like that from your users. So I think it makes us all smile. So as I understand it correctly, for those of you who don't know what a continuous glucose monitor is, because I didn't know until I started working with the Guidepost team, it's this magic little thing that you stick to your arm. Am I right, Tracy? And it reads continuously every couple of minutes your blood glucose level. And then your system takes all that data and then looks at what the trends are in that data. And you use some fancy AI. So I'd love you to explain what that part of your product does and how that works.
Sure. So we've been using AI since mid-2020, and what we began using it for was decision support for our coaches. So we use AI to recommend interventions that they can take with somebody using the data that we've got in the system. We also calculate estimated HbA1c so that they can measure progress. And we provide pattern analysis on the blood glucose that people are submitting to us, so that we can move them from being in the moment to reflection and building next steps, exactly what we're doing in the auto coach. Now, ultimately, we ask them to set little goals that lead to small cumulative wins. And now we're incrementally building those same tools into our auto coach chatbots, and they're going direct to the people with diabetes who are interacting with those chatbots.
That's, I mean, super cool. And what are your general thoughts? I mean, there's a big blow up of AI and health at the moment, with all of these large language models coming out, and you know, you get the people on the one side going, you know, you shouldn't be using these generative AI or any AI in health services, and are really nervous with a lot of fear behind these things. And on the other camp being like, these tools are so incredible. We should absolutely be leveraging them as long as they have a human level of review. So what is your thoughts on AI and health more generally, as you've been using it for so long?
I think I'm in the latter camp, very much so. So one of the things that AI is really great at is synergy with people rather than replacing people. And from what we've seen, what we've implemented is it's adding power to what people can do. It's helping them do it more quickly. And it's definitely allowed us to scale and to automate much more, particularly on simple things. So it's just provided the power that we need to get to more people.
Awesome. So we all have challenges, trials and tribulations when we set up these services as an iterative approach. You know, we launch something to the world and people don't use it as we expected, or we might have some stumbling blocks on the way. I'd love you to share some of your challenges that you faced building out the service, or even after you launched it, things that you found surprising that your users started doing.
Well, our challenges have come from two aspects, and definitely looking at what people were doing with it. But our number one thing was being able to keep it simple and to find there's so much that we want to say. But we really need to avoid throwing a mountain at the person who already has so much to deal with. And our most notable response over the years in dealing with people is watching them withdraw when it gets too much. And so looking for the small bit that's going to have enough of an impact, and it's much smaller than we would think it would be, has been one of our biggest challenges. And being able to measure when somebody does take hold of what we're offering and engage back has been the most rewarding thing. And the second thing that we've really found, because when we set out to do this, we needed to build a layer of integration into our existing system, because we wanted ongoing automation. We wanted to keep a record of all the messages that we were sending, and we wanted to link in the AI in a meaningful way. And so we're using our bespoke guidepost platform. It does give us an electronic health record and coaching relationship manager. And that's what we're using to drive this auto coach process for each person. So that combination of building the chatbot and then linking it into the system has definitely been much more challenging. It's taken longer than we would have expected it to do. And I think then a funny thing that hasn't always been so funny is when you're managing large volumes of data at scale, it's really easy to get it wrong at scale. And so being able to go in and check on the experience of the individual while operating at scale has been vital for us. It's just really difficult to manage both of those in one go. So yeah, those were our
I love that focus. I mean, bring it, like making sure that you're not forgetting a single user's experience. Like, what is Tracy's experience with this chatbot, and how is she she experiencing it herself, as opposed to just looking at large numbers. You know, we've reached thousands of people and this is the trends overall, but going back down to that individual, I think is a really great piece of advice. And I encourage all the teams to, you know, use the help desk inbox functionality to go and look at some of the experiences that users are having and get a real touch. It's often these like strange qualitative insights that you get from looking at real user journeys through your chatbots as well. So I love that advice. So you know us, we've got big ambitions here at Turn, and we always talk about wild success. So what does wild success look like for Guidepost?
Well, our mission is to have every person living with diabetes able to live a long and healthy life. So success using the auto coach chatbots would be for us to see nearly every person with diabetes in South Africa on the program, engaging regularly with the chatbot, but at the intensity that suits them and that they are comfortable with at their stage of life right now, and then being able to see measurable improvement in their diabetes control as they find the staying power to do what they need to do.
Nice. Awesome. So we're here every step of the way to get you to that wild success, and we love working with your team. And I want to just hand over to anyone who wants to ask a question. So I see Titania has already asked one in the chat. She's asking, how can users join Guidepost?
Well, Titania, I didn't come fully prepared. And if you give me a minute, I'll be able to find you a QR code that you can use to do exactly that. And we'd love to have you join us.
I think we can pull it up in our presentation quick for you, Tracy. And the other question was whether this is only open to South African patients.
At the moment, it is only open to South African patients, unfortunately. When Guidepost is able to, we definitely like to expand. And one of the places that we will be expanding soon is into the Middle Eastern region. So watch the space and maybe we'll come to you soon.
Very exciting. Okay, we've got some other questions coming in. Is Guidepost fully reliant on WhatsApp, or do you have other digital platforms?
We're only using WhatsApp at the moment. In addition to, we use SMS for things. I wouldn't really term that a digital application necessarily. And but we are definitely multi-channel. WhatsApp, however, is the major thrust of the digital communication.
Why is that, Tracy? Is it just to start to dominate in one, or are you finding your users not?
You're on mute, Pippa.
Sorry, Tracy. I was just wondering if there's any particular reason behind starting with WhatsApp, or whether you guys are planning on expanding to other channels in future, whether you want to master this medium first.
We have no formal plans to move to other media at this stage. We like the WhatsApp channel because it's simple, it's accessible, and we think that that makes it sufficient for what we need to do. Maybe in a few years' time, we would look at something different, but I don't see that being the immediate approach.
Okay. I just want to check if there's any other questions coming from the audience. You also feel free to unmute yourself and ask in real life. I'd love to hear some real voices.
Hello, me Bijan Vatrai from Dio.ai. I have one question. In that slide, there is 10 health organization will be selected in presentation. It is shown like that. Does that team must be a health organization or a tech company?
But I'm really sorry. I was actually really struggling to understand what you said. Would it be possible to repeat it and let me see if I can hear you the second time? My apologies.
Oh, okay. Actually, in the slide that you have shown earlier,
Yes.
There is shown written that there 10 health organization will be selected for next round.
Oh, okay.
Oh,
Is
yeah,
that one
yeah.
health organization will be selected or a organization working in a health project?
So you're talking about the health accelerator?
Yes.
So for the health accelerator, it specifically the applications we're looking for health organizations. So all the applications we got, we're specifically the criteria that we're looking for the 10 organizations to join the accelerator are organizations solving problems in health. Similar to Guidepost. Guidepost was one of our accelerator participants last year. So for those of you that have applied to the accelerator, Guidepost is one of our examples of all the cool things that you can do as a result of joining us on that journey. But I want to hand over, I hope that answers your question. I want to hand over to Joe, who's got his hand up. Joe.
Hi, yeah, thanks very much, Tracy, for a really inspiring case study. I'm Joe from RV Health. We're actually going live with Turn tomorrow, which the team is very excited about. And we're coaching for people with hypertension. So we'd love to kind of connect and learn a bit more from the work you've done, which I think is fantastic. I had a few problems with my internet connection. I may have missed this by dropping out, but I just wanted to ask, with the continuous glucose monitor, is that in some way integrated into the platform and therefore kind of like data coming into the WhatsApp channel, or is it a bit more manual at present? So what's the level of integration, I guess, is the question between the device and the engagement through the coach, the auto coach?
So we do have a level of integration between our platform and the manufacturer's platform where the data is actually stored. And so we were receiving summary data. We receive summary data, which we then use in our communications with the people using the service. Great.
I mean, as I say, if it's possible to reach out to you afterwards, I'd love to talk to your colleagues within your team a bit more about that, because it's something we're looking at. But yeah, thank you, and yeah, really inspiring the work you've done with Guideposts. So thank you.
Thank you.
Great, thanks, Joe. So there's some questions in the chat, Tracy. So are there do you use any platforms for users that don't have smartphones? And how successful has that been? You mentioned SMS a little bit. Is there anything else you're doing for users without smartphones?
Papa, our immediate product release is mainly on WhatsApp. We haven't even done much on SMS on the particular releases that we're doing at the moment. We may extend it later on, but we really want to see where we can take the WhatsApp thing. So short answer is not really too much further.
Okay, cool. And then I know you've been through a little bit of a journey with translating into other languages recently with your exploration into the Middle East. So there's a question about interpretation to other languages and whether you guys are thinking about that.
At the moment, our system and the Turn platform both have the ability to specify messaging and respond to messaging in other languages. We've implemented that in a first level into Arabic, and we've had some good success. We've set chatbots up that we managed to build no code data tables for, where we have the messages in multiple languages and then refer to them in the chatbots. And that's been very successful, which allows us to release chatbots into both locations and just put it into the right language and change the cultural aspect of reaching the person. So we're on our way there, and we know that there is plenty more that we can do, and we're looking forward to doing it.
Okay, great. There are questions now coming in fast and furiously, and we won't get time to cover them all. So I'm going to get the last one, but we can continue this conversation in the Townhall WhatsApp group. This is exactly the types of chats that we want to have there. Maybe, Kanya, if we can get that QR code for the WhatsApp group back online so that we can continue this conversation. But last but not least, Tracy, I want to ask you, Do you have a tailored approach for women who do not have diabetes yet, but maybe could develop it, or any diversification or preventative approaches?
It would be something we would like to do in future. And we've definitely touched on the idea of pre-diabetes. It is something that we're looking at doing in the Saudi Arabian sphere first. I see the extra answer as far as PCOS goes. It's one of the risk criteria that would determine whether you're likely to develop diabetes. However, what we're focusing on right now is once somebody has diabetes, catching them as early as possible so that they don't progress further. At the moment, that's where the funding is. There was a question about how we get paid. It is partly from provider visits. And so definitely the funding is for somebody who already has diabetes, but we'd like to extend in that direction. Not yet, though.
Exciting. Well, I'll watch this space. Okay, so thank you so much, Tracy. I really appreciate all you answering our questions today, and loved all the interaction from the audience. And we will continue this. We'll pop those last few questions in the town hall group so that you can answer them after this. But thank you so much for all your time. Really, really appreciate it. And thank you everyone on this call. I think seeing so many faces here has been fantastic. And we love these monthly catch-ups, and you know, the next couple of weeks are going to be super exciting as we choose the 10 finalists for the accelerator over the next 2 weeks, and then we get cracking in August to help guide and explore you. And for those of you who didn't apply, you know, we're always here. The town hall group is going to be really active from now on, with everyone sharing their knowledge and guidance, and of course come see us here again at next month's town hall. But thank you all for joining, and have a wonderful rest of your Wednesday. Goodbye everyone.